There are many skin treatments available in this technology of cosmetic. To improve facial appearance and to get rid of ugly effects and lines on the face, cosmetic science has given the world a number of alternatives. These two are such cosmetic options. Botox and Dysport are both types of botulinum toxin type A injections that have been approved by the FDA for cosmetic use from moderate to severe frown lines between the eyebrows. These two injections are primarily identified for the treatment and prevention of wrinkles. Botox is mostly used for few treatments because it was the first injection-able botulinum toxin. The difference between the two is the potency of protein tracing, which can make one diverse from another. Both work via the same mechanism. Both toxins are used by doctors to improve the appearance of the face by reducing the wrinkles the under eyes and forehead. For both types of treatment, no hospitalization is required. You can leave immediately after the procedure is done. They both are formed for the same procedure and are also chemical similar, but there are few key differences between the two which are explained below. So read the specification/difference carefully. Comparing Dysport versus Botox. Dysport versus Botox, for around-eye wrinkles. Botox is approved for treating forehead lines and crow's feet in addition to glabellar lines, whereas Dysport is approved only for glabellar lines and not for forehead lines, as well as not for mild glabellar lines. Your dermatologist can easily explain to you the difference between mild and severe wrinkles of this type. Common wrinkles around the eyes embrace a total of 11 lines. The two parallel lines that form between the eyebrows and crow's feet. Dysport is the best treatment for those 11 lines, which is characteristically retained for deeper wrinkles. Whereas crow's feet are often treated by Botox, which avoids any drift of the botulinum toxin toward the eyes. Dysport versus Botox, for lip lines. Lip lines are basically the vertical wrinkles above the lip and are known as smoker's lines, which require an advanced specific injection procedure. Botox is the better choice to treat lip line wrinkles than Dysport, since the neurotoxin of Botox will stay put in the small area into which it was injected. Also read, what is Botox lip flip, and how much does it cost? Dysport versus Botox, cost. The average cost for both neurotoxin botulinum injections, Botox and Dysport, can be $400 per sitting. In a 2016 study, it was clear that Botox is a trouble-free, secure, and effective wrinkles treatment. At that time, the average cost for Botox cosmetic treatment was around $376. This cost may vary depending upon the size of the area to be treated, the number of injections, and certainly the geographic location where one is going to have this treatment. On average, Dysport is comparatively less expensive than Botox, as it is an elective treatment, so the health insurance does not cover the cost of injections during the Botox treatment. When choosing the provider, then it is necessary to confirm that the provider is licensed to administrative Botox cosmetics. Dysport versus Botox, dosage of toxin. This is one of the important differences between the two injections in that their doses are relatively different from one another. Botox takes 1 unit of toxin to relax the muscles, while Dysport needs to take 3 units of toxin to calm down the same area of muscles. The standard dose for Botox usage is 20 units. It was found that dosing 20 to 40 units of Botox were more effective than 10 units alone for reducing frown lines. So for Dysport, the standard unit of toxin is 60 units. This distinction plays a significant role in the treatments. In addition to this, it is necessary to confirm that the provider is licensed to administrative Botox as well as Dysport cosmetic for proper dosage. Dysport versus Botox, molecular structure. The formula for Dysport contains a smaller number of molecules as compared to Botox, which may be beneficial for some areas to be treated. The molecular structure of Botox is approximately 900 kDa, and for the Dysport, which is roughly 800 kDa. Smaller molecules enable the Dysport treatment to work faster in large areas to spread the toxin into the treating area, because minute molecules can spread easily than the large ones. It is recommended for a patient to go to a specialized medical person who can better judge the dose and the area of placement for your neurotoxin. Dysport versus Botox, the onset of action. It also differs in both wrinkle treatments. Dysport is the fastest to take action at around 24 hours for all results to be realized, and lasts for 3 to 4 months. To fully establish the positive effects of Botox injection, it may take up to 72 hours, and this lasts up to 6 months. It is really important to know that Botox and Dysport treatment is not permanent. The outcome of the practice lasts about a few months since only a small amount of toxin is injected into the skin. After this duration, to maintain the treatment effects, you need to get the procedure redone. Dysport versus Botox, rate of dilution. Botox and Dysport dilute differently. The Dysport has more capacity to dilute than Botox injection. This states that you need to have more Dysport sittings to get the same results as Botox. Though a greater dilution rate does not mean that Dysport is a less effective toxin, it just means a higher quantity of Dysport toxin is required to get the equivalent level of effective Botox injection. In terms of cost, it won't be harder to the pocket of the patient, as the cost of 1 unit of Dysport is much lower than the price of 1 unit of Botox. Dysport versus Botox, factor of diffusion. Diffusion of botulinum toxin depends upon certain factors like dosage, needle size, and rate of injection, concentration, and volume of toxin. In terms of diffusion, Dysport toxin clutches the edge. It has the ability to diffuse effectively more than Botox. It causes to spread in a larger area after being injected, means that the larger area can be treated with fewer numbers injections. This is advantageous while addressing larger treatment areas. However, this diffusion factor states that Dysport is less effective in treating smaller areas with thicker muscle strength. A patient requires a high dose of Dysport, so the elevated concentration and lofty volume mean greater the risk of diffusion. Dysport versus Botox, eligibility. As long as you are under 65, you always have a chance to get both botulinum toxins, Dysport and Botox. If you are allergic to any of the ingredients or had a previous allergy to any of the botulinum products or skin infection on a planned injection site, then do not take the treatment. If your body is not healthy enough to handle the minor side effects of the treatment, then do not dare to take any of these injections, as it can be risky sometimes. A person with a prior breathing problem must not take the Dysport as well as Botox injection, because upper respiratory tract infections were also reported more frequently in such treatments. Dysport versus Botox, side effects. Although Dysport and Botox are considered to be safe forms of cosmetic treatments, still there are minor side effects for both. There is no reversal for the procedure. The process needs to be redone for a continuous look. Slight swelling in the treated area. Rashes as well as skin irritations at the treated area. Mild to severe headaches. Most of these side effects should clear within few days of treatment. However, if they don't, then you must consult your doctor to get the immediate remedies.